Welcome to the Senior Rehab Podcast,
the podcast for rehab clinicians that want to better serve older adults.
And now, your host, Dustin Jones.
Shorts. Hello, friends. Thank you for listening to the Senior Rehab Podcast. This week's Senior Rehab Shorts comes from Andrew Rothschild, who is a physical therapist and a previous guest on the Senior Rehab Podcast. We did an interview with him and Ursa Religioso on using manual therapy in geriatrics. He was so gracious enough to write a post for the Senior Rehab Project blog titled, "What You Need to Know About Manual Therapy in the Geriatric Population." If you pay attention to the photos in the manual therapy and orthopedic journals as well as clinic websites, it will appear as if manual therapy is only performed on young, seemingly active, and healthy individuals. This could not be further from the truth. Manual therapy is not exclusive to only one segment of the population. Manual therapy can be a beneficial intervention for almost all of our patients, regardless of age or ability. While the effectiveness of manual therapy has been documented in the literature for a variety of conditions, the mechanisms of manual therapy are not fully understood. So, a word of caution first. Prudence should be utilized when we describe how and why certain techniques might work. For example, we are not putting bones back into place, nor are we changing the alignment of joints. Whether or not we are affecting blood flow is also questionable. What we think most likely is happening is a neurophysiological response, both locally and centrally, on mechanisms that help alter pain perception, reduce muscle guarding, and reduce local muscle inhibition. What we are also doing is helping people feel good. We may be helping to reduce fear by demonstrating that certain movements and positions are not actually dangerous by modifying inputs into the central nervous system. For more in-depth information, see the article by Bialowski et al. On the proposed mechanisms of manual therapy, which is linked in the post. The laying of hands on someone with a therapeutic intent can be a powerful thing. There is research that manual therapy may help trigger the release of hormone oxytocin, dubbed the bonding hormone. Oxytocin is one of the hormones that may be responsible for the bonding between a mother and newborn, among other things. Now, I'm not saying we should start cuddling with our patients. That would be highly inappropriate. Let me check my state regulations. Yes, highly inappropriate, but you get the idea. So what conditions would manual therapy be appropriate for in the elderly population? For starters, anything that's appropriate for almost any population, certainly post-operative conditions such as total knee or hip replacements, which are common orthopedic issues, especially in the home health arena. Soft tissue mobilization as well as mobilizing joints above and below the affected area is appropriate. Determining the choice of technique to utilize with the senior population is when certain considerations need to be taken into account. What is the state of the tissue? What comorbidities are present? What medications are they taking that could affect their tissue or general sensitivity status? For example, would I perform a thrust manipulation to the thoracic spine in an 80-year-old female? Probably not, because I need to consider issues such as bone density in the spine and especially the ribs. A low-grade mobilization will likely be better tolerated and received and will be effective if my goals are to modulate pain and improve perception of mobility. Bottom line, use common sense when it comes to application of force based on what you know about the patient in front of you. Who should perform manual therapy? Any physical therapist or occupational therapist reading this or who listens to Dustin's Senior Rehab Podcast is probably able to, as long as it's within your profession's scope of practice. Just because you may not have any specific formal training doesn't mean you aren't able to perform certain techniques, so don't let that be a deterrent. However, if you are uncomfortable with certain manual procedures, that alone is an indication to not do them until you feel comfortable doing so. That being said, if you're interested in improving your skills and expanding your knowledge with manual therapy, there are several resources available. And before you know it, your patients will be doing this. Elderly residents performing the whip or nay-nay. He linked to that funny video in the post. Thanks, Andrew, for writing this. It was helpful for me and definitely a topic that I will continue to dive in and see how I can better serve my patients. Hit me. I want to thank you for listening to this podcast. The show notes and much, much more can be found at seniorrehabproject.com. I want to encourage you to go there so you can join me and many others in the movement that's changing the face of geriatric rehab. Just go to seniorrehabproject.com, click join, and you'll be able to get access to our private Facebook group, which can basically serve as your virtual mastermind group. You'll get a short and sweet monthly email from me with useful links for you and your patients. And lastly, you'll get 10% off your first purchase from the Senior Rehab store. So all of this can be found at seniorrehabproject.com. And until next time, my friends, do not forget to stay funky.